Much. We will come back with some further questions, but I do want to get to Mr. Cheyne, the research director with the Berkeley Media Studies Group. Welcome.
Thank you so much, Chairman Monning, and thank you, Senator DeSaulnier, for giving me this opportunity to speak. My name is Andrew Cheyne, and I direct the research program at the Berkeley Media Studies Group, a project of the Public Health Institute. It used to be Cheyenne in the 90s, now it's Cheney, it just sort of evolves with the times. But for the last 20 years, at Berkeley Media Studies Group, we've been investigating public health issues in the media, examining how the stories that are told characterize the role of government, including other issues of health. And what we've learned is that it's hard for the average person to see the government's essential role as the protector of public health. So I'm happy to be here today, not only as a public health researcher to share what we've learned, but also as the father of a 6-month-old son, as that experience has given me newfound appreciation for the government's protections we all enjoy. I'm certainly seeing the findings from our research through a new lens, to say the least. I'm especially happy to be here today because this hearing is very important on an issue that is often taken for granted. It's absolutely vital for public officials to take leadership as stewards for a healthy society. Our topic today is all about that. Let me tell you a brief story about why this is from one of the most valuable lessons in the history of public health. This story is about the fact that gathering support for any policy change, let alone those that are bold and controversial, takes time. Consider the state of New York, which just 3 years ago proposed a penny per ounce tax on sugary beverages. That effort failed, but in the same session of the legislature, lawmakers added a $1.60 excise tax on cigarettes that is credited with dramatically reducing smoking rates and healthcare costs, as we've seen here as well in California. Why would New York legislators levy $1.60 on tobacco but balk at 12 cents on a can of soda? Well, the answer has a hard-fought history. For nearly 50 years, public health has pushed for policies to put warnings on cigarette packs and advertisements, remove vending machines, mount educational campaigns, ensure smoke-free air, and institute tobacco taxes, all of which are evidence-based interventions that lower smoking rates and improve public health. But it wasn't always that way. In the early days of tobacco control, proposals for taxes met the same fate as New York's soda tax initiative. But strategies like taxes, with far-reaching potential, warrant continued attempts. Given our tobacco experience, we know that it will take more than one attempt. Therefore, even though public health didn't win that round in New York, I'm heartened by this effort. Because the more a policy is proposed, the more people have a chance to discuss and understand it. Policy proposals create opportunities for news coverage that help set the agenda for public debate. Now, these discussions reflect some criticism for taxing sugary beverages. But each new attempt also gives people the opportunity to communicate the fact that someone, and as policies attempt Mount in Richmond, El Monte, and elsewhere, reflect the fact that growing numbers of someone support the policy. This movement helps set the stage for the day when it is a given that these beverages do damage to our society and government needs to protect the public's health from that harm. Perhaps one reason it takes so long to achieve these policy victories is because the news, the institution so important for helping the public and policymakers understand public health issues, is not always telling the whole story about the importance of government successes in protecting our health. I've heard obviously many today. But instead, research shows that the way the news tells stories means that news consumers often focus on individuals and their actions rather than on the role of institutions like government. When new public health initiatives are proposed, they often create controversies that easily generate headlines. But long after the attention dies down, the benefits to public health and safety that these policies produced become normal and expected and can fade into the background of society. They aren't newsworthy, so the public doesn't get the story about what is working. No one wonders where the non-smoking section of the airport is anymore, or bemoans the fact that children can no longer purchase cigarettes from vending machines. Even I can remember that. Or complains that an airbag saved their life. No new parent would leave the hospital without her newborn tucked safely into a car seat. We simply take it for granted. And not only are we able to take these protections for granted, but news coverage reinforces this idea by focusing on the notion of rugged individualism, which presents problems or accomplishments as the result of personal choices, while minimizing how social forces and public policies shape people's lives. This matters for government's ability to protect public health because it makes it much harder for the public to see how government or other institutions are a critical part of the solution. Let me give you just one example. At the Berkeley Media Studies Group, we've studied the origins of personal responsibility arguments in tobacco control, an area, as we've heard, where public health has made strong gains that have been made through government actions, even while the tobacco industry has poured millions of dollars into fighting these ideas. But by examining the first national fights over tobacco regulation, we found something quite extraordinary. In the 1950s and 60s, the tobacco industry did not question whether the government was accountable for protecting the public's health. Instead, when it became clear that cigarettes harmed health, the industry did not attack the idea that government had a protective role, as is so common today. Instead, industry voices were part of the many who said that if there is a health harm, government has a role to play in solving it. Therefore, despite its intensity, the attack on the responsibility of government is relatively recent. It has not always been a prominent feature of our political landscape. And thus, it is important to reinvigorate enthusiasm for sensible policies that provide broad social benefits. New policy proposals generate debate and news coverage that often evokes the question, what is the government's proper role in ensuring a healthy population? Our research consistently finds that the news often tells an incomplete story that hides the many ways in which government effectively protects the public's health, and we know that there are many. The government is a source of information to help individuals make healthier decisions, from warnings on packages of cigarettes to cancer disclosures on buildings in California, thanks to Proposition 65. Government takes population-wide actions to boost health, such as iodizing salt or mandating immunizations. Government enacts rules to protect individuals from preventable harm, such as zoning and emissions regulations limiting exposure to industrial pollutants at the Port of Oakland, or blood alcohol from the dangers of intoxicated driving. Subsidies for low-income seniors to have affordable telephone access through the Lifeline program enable our elders to live independently much longer, along with the safety to reach help in times of need. Public health has worked with public works agencies to build sewage and sanitation systems that reduce infectious disease and simultaneously reduce rodent populations and prevented flooding. Public health also worked with transportation agencies to introduce seatbelts, safer road designs, and other innovations that together have led to major declines in the rates of automobile crash deaths, some of those data we saw recently. And we know that building bike and pedestrian infrastructure creates more jobs, decreases air pollution and greenhouse emissions, and increases physical activity, all of which improves health and academic performance for students. I'd like to conclude by illustrating the importance of making government visible by telling you about the birth of my son, McEwen. Having a natural childbirth was important to my wife and I, especially her. So we stayed at home as long as was manageable before going to the hospital, something made possible only by the government system of maintained and financed roadways. We were fortunate enough to have a hospital experience that promotes breastfeeding, the single most important health advantage one can confer on a new child, which may soon become a reality in all California hospitals, thanks to SB 402. We brought the baby home in a car seat and vehicle designed with safeguards to ensure that our precious cargo was as well protected as possible. That's an improvement from government policies that's happened in my lifetime since I wasn't brought home from the hospital tucked safely in a car seat. My wife and I were each able to take time off of work to care for the baby, thanks to state disability and federal Family and Medical Leave Act policies that prioritize bonding with newborn children. Our transition back to work was of course difficult, but made much easier knowing that our child care provider was following rules and properly licensed with county and state rules for best practices. His health is already building from the state mandated and subsidized immunizations, and we're looking forward to his first flu shot this week. Going forward, we know that our journey as parents and his path and his health as a growing boy will be touched by government for years to come, including the availability of the clean tap water he will drink, the public education from kindergarten to post-secondary we're sure he'll achieve someday, the now healthier meals and drinks available in schools, and the safety features of the cars he'll drive. The list could go on, but I can't bear to think even that far in the future. Leadership and innovation aren't always easy, but we owe it to the people of California to work together to find the best ways to solve complex problems. Government support, which is our mechanism for pooling our talent and resources, will help us do that. Our democratic system requires two things, not only for public servants to be responsive to the needs of the citizenry, but also for citizens to be active and to petition our government with demands. From this perspective, an initiative to protect public health that emerges as a community concern and becomes a legislative proposal reflects the fact that government is each and every one of us and provides a structure for addressing shared needs. I thank you for investigating this critical issue, and I urge you and your colleagues to continue to lead the state to a healthier future for all our communities.
Thank you, Mr. Cheyne, and appreciate your close using your own experience. What's your new son's name?
McEwen.
And
Also hard to spell and pronounce.
Right. Well, You said you and your wife were looking forward to the first flu shot. You didn't say whether he was looking forward to the first flu shot.
Baby Tylenol is a miracle.
Thank you. Well, thank you all. This has been a great panel. Senator DeSaulnier, any questions? Again, I think the theme of this in all of your presentations has illustrated public health benefit, first and foremost, health and saving lives, the quality of life, and secondarily, but important, reducing the cost to government, to taxpayers, and then not always a government cost, but a societal cost as well that is reduced when there are successful and effective interventions. I was particularly interested, Mr. Cheyne, in your tracing some of the reaction around early tobacco discussions. First, the advertising promotion and the cover-up, well proven now, of knowing of the adverse health impacts, that not being shared. And then as government got involved, that the tobacco industry did not target the government as the bad guy. There was tug-of-wars and informed discussions. Do you, in your research, what do you attribute this evolution, if you will, to government being vilified, the nanny government mentality? Any sense of causes or projections for how we might grapple with that, other than the examples you shared?
Certainly. So to make a long story very short, we were looking at the era around the 1964 Surgeon General's report, which led to the Federal Cigarette Labeling and Advertising Act in 1965. Basically, the first really bold federal legislation that led to the package warning labels on cigarettes. And what we found was that the tobacco industry was incredibly active, but they weren't attacking the notion that government should do something. They, of course, tried to sully the science on whether cigarettes were causing lung cancer, blaming it on a source of other things. But they only tried to move federal action from the FTC to Congress, where they felt they had more influence. And of course, that's what happened. We ended up getting federal legislation instead of potential action through the FTC. But work done by others has continued to trace this, and there's a very interesting paper out by Stan Glantz from University of California, San Francisco, and some of his colleagues, I forget all the colleagues' names, excuse me, that really look at the active role of the tobacco industry in seeding what's now become the Tea Party, and not just them, but many of the anti-government sentiment, and the real multi-decade work through financing, developing messages behind the scenes. And so the tobacco industry has been one of the players that's really helped make our current discursive environment, in which it's so easy to attack taxes and the role of government, et cetera, to make that possible. So I think that paper is well worth reading. And our own research, which actually extended what I was referring to here, showed that argument didn't, in fact, occur until the middle 1970s. And so again, it was sort of anticipating the sort of movement in which Ronald Reagan comes to power, and that sort of anti-government sentiment becomes such a part of our national political conversation. So I think it's very important to understand that some of the health policy and political battles have actually been a central part of the role of government as it's understood in this country.
Well, thank you. And you did cite examples both of kind of the immediacy of media coverage today and keying on something that might be seen as intruding on individual rights and our history of rugged individualism, and the lack of memory of improvements that have saved lives and are relied upon and taken for granted. So I think maybe one of the questions for us as policymakers, and one of the purposes of today's hearing, is how do we do a better job of making the community at large aware of that. And as you suggested, a healthy democracy is one where the community is involved in crafting, feels ownership of some of these policy initiatives to protect and advance community health, that it's not a top-down imposition, but it's a grassroots effort for protecting the public health. But out of respect for our next panel, I want to thank you all for sharing your time today, and more importantly for the work you're doing in our communities to protect and advance the public health. Thank you very much. And with that, we'll invite our